So our final speaker today is Dr. Jennifer Horsley-Silva. She was one of our GI fellows, and we were very privileged to be able to retain her here on staff. She is swiftly becoming one of our experts in the esophagus and is going to talk to you about some new updates and what's new in eosinophilic esophagitis.
Good morning, everyone. I think I'm the last talk before you and lunch, so I will try to be efficient but keep you entertained. So I'm just going to briefly talk about a couple of things, and I have no disclosures. Today I want to review what's known about the pathophysiology of EOE. I want to examine how EOE is diagnosed, and I also want to summarize the current treatment therapies for you so that you can go and use this in practice. So eosinophilic esophagitis, and I'll use the term EOE frequently throughout here, is an allergic esophagitis. And it was first recognized really around the early 1990s in several case series that were performed. In the 2000s, we made headway with phenotypes being defined and therapies were starting to be established. And there have been numerous updates in international consensus guidelines as this disease has progressed. The ICD-9 classification first came about in 2008, and just to give you an idea, it's been 25 years since this disease was first recognized. So it's rapidly emerged over the last 2 decades as a leading cause in esophageal morbidity, and it's been estimated up to $1.4 billion in cost annually in the U.S. has been accrued in this disease. It's an active area of research, and there are lots of diagnostic tools and treatment options that are rapidly emerging. Addition, for those of us who pull call, this is now the leading cause of food bolus impaction in young adults, so that's something to keep in mind. So what we know about this disease is that it's an aberrant antigenic or immune response. And there is some genetic susceptibility. There have been 3 altered genetic loci identified involving a thymic stromal lipoprotein, eotaxin 3, and calpain 14. And so some of those things have been markers that have been tried to be studied over this time period to see if we can use that as a marker of the disease. So what happens is that there's an acute allergic inflammation that occurs in the esophagus, and that causes a cascade to happen. Type 2 helper T cells then cause inflammatory response from that allergen trigger. They then release cytokines, and IL-5, IL-13, and IL-4, also involved in this, stimulate the esophageal epithelium to produce eotaxin 3. The eosinophils are then recruited, and they release more granule proteins, causing cytotoxic damage and ultimately disrupting